Welcome to the office. Hey Linda, how you
Nice
doing?
meeting you.
Nice to meet you. And what brings you to the office?
I have always had back problems, and my husband has noticed that recently I've been doing more and more bending over when I walk. I've had to use my walker. I cannot walk without ambulatory help.
How long have you had the walker?
2 or 3 years?
2-3 years.
Yeah.
But there's an underlying condition that we need to talk about. And you were diagnosed with multiple sclerosis, right?
Right,
And you were diagnosed with MS over 50 years ago.
right. And then 20 years into that, I believe I had a seizure,
Okay.
a grand mal seizure, in fact.
Okay.
And so they knew that I had epilepsy because of my MS.
Okay.
So I've
So
been
that
on
was that was 30 years ago then,
Yes.
right? Okay. And you've been on medication for the epilepsy
Mm-hmm.
and any other medications?
You know, I used to be on Copaxone. I was up part of a test study at USC actually, but I don't have any medicine I'm taking for my MS. Just for epilepsy to make sure I don't have another seizure.
Got it. And how about your food intake? How's your diet? Pretty clean?
I'm trying to go with less sugar.
Okay.
That's not easy, I must
You
say.
like your sugar? Do you like your sugar or you like your cakes, chocolates, ice creams?
No, it's
Or
not.
you like your candy sugar?
She
No,
doesn't,
I
she
don't.
doesn't really like sugar very
I
much.
really do keep it in check, but because I know it's not good.
But what do you crave more? More of the cookies, like the ice creams, or more of the sweets when you crave it?
Wow,
Neither
when
one.
is that?
Okay.
No,
She
'cause
doesn't really crave any kind of
I'm
sweets.
keeping that in check, but to me, I'm still eating
Okay.
a lot of sugar because so many drinks, everything. Even though I don't have any soft drinks, I don't have anything like that.
Mm.
So my diet most likely is staying.
She's got a pretty good diet.
Yeah.
I do the cooking.
That's why.
Yes, he's an excellent cook. I'm so fortunate.
Good for you. Okay, so, but you're here because you have some structural issues going on.
I
and-
never knew it was this bad.
I mean, there's a few things going on we need to talk about. Have you ever had a full spine x-ray done?
Didn't I have it at Kaiser?
Not that look like that.
Okay. Was it a whole x-ray though, or just
Yes,
a piece?
there is.
I don't remember ever seeing one.
Because
Okay.
they were thinking of replacing one of my vertebrae, or 2 vertebrae.
No, not replacing
A
it.
disc.
They wanted to fuse them.
Oh, yes, but it was,
Right,
yes, they were.
Right, 1 and 2, I think it
A
was.
dead person's,
Or 2 and 3, I
Yeah.
forgot.
and there was
We
some,
rejected that idea.
And the idea in this case is she was diagnosed with MS many years ago. There's been some changes, obviously a lot of neurological changes along the way. Epilepsy or seizures became an issue. What are we doing here though? And how am I going to help you? We're going to check your nervous system. We're going to check your spine. And we're going to see, is there anything out, number 1, that's causing nerve pressure. Number 2, we obviously have to check her foundation because that's the bulk of the work that I do here.
really?
And yes, this is think of your body, this is a 24-story building. This is the foundation of your 24-story building.
Right.
If we don't have a level base and foundation, we got no business working on the rest of the building. That's how I work, okay? And yes, we can see you're a little crooked in here, okay? The good news is this, if I run a line from the tailbone up,
Yeah.
what this tells me is a lot of this stuff is compensation. So there is a chance things can still change for you, ma'am.
Oh, great.
Okay, and let's look at the overall picture of what's going on here. And as I mentioned, we have to look at her foundation first. You can see there's a lot of twisting of her foundation. The obturator here is really tiny and small. This one is really big. It's not that they're different shapes. It's the x-ray projection due to misalignment that makes it look that way. You can see this looks real. This hip looks really big compared to that. Let's look at the numbers now and see why is it doing it, and this is going to make a lot of sense. So what we have going on right now is this. We have a rotated sacrum on the left side, 13 millimeters, and we have a severely rotated pelvis, almost 26 millimeters on the left side. The This is the pubic bone. This is the bum's over here. The sacrum's over here. So there's a lot of disconnect right now between her tailbone, the crease of her bum, and the pubic bone. But all of this is coming from the foundation first, ma'am, in terms of the structure. Do you see what I'm talking? Sir, do you see what I'm showing?
Yes.
Okay. So the idea is we need to determine, I'm pretty sure we're starting in the tailbone, okay? I'm pretty sure that's where we're starting. Now, we're going to have to work on some of this pelvis. Right now, there's only a 2 millimeter difference. If I try to fix all of your pelvis, I'm going to create more imbalance in your hips. So that's not our goal here. Our goal is to stabilize, not to make it more. Okay?
Of course.
Now, let's go back to this and let's see. There is something here. I don't know what this is. There's some calcific cyst or mass here inside the colon. You see this bright white thing?
Yes.
Okay. We need to also work on her digestion and talk about it because you have a lot of undigested food going through your colon, ma'am. Now, as we go up the spine, okay, so we have that hard kink here. It'd be really cool if it's almost 2 inches, an inch and a half, 2 inches of height lost because of that kink. Okay, as we go up the spine, all of this is compensation here, guys. And let's get to the upper cervical and see what we got going on here. And it is also very subtle. C2, C1, I'll come back to that. Let's go over to this x-ray and let's talk about what's going on here. And I want you to look at your posture here. We want to see if we can get the rest of your spine up here moving forward. You can see everything is tilting from this L5, right?
Right.
This L5 is tilting, it's taking everything back. So L5 is going to be one of the issues we need to address and deal with. Now, let's continue on. And let's look at your neck and upper back. The mid-back I like the mid-back curved neck. Here's your old whiplash. This is probably what they want to fuse here. C2, 3, C4, C5, C6.
Yeah.
So C6 and C7, this is what we got to open up here for her. Now, I did a flexion extension to get some answers. This is extension, okay? And in extension, you were getting a little fearful when we did this, remember? You were a little off balance when we in the x-ray room. There was a little bit of fear there. And I have a feeling, were you feeling more off balance when you were looking up?
Yes.
Is that what it was?
Yes.
Yeah. Now, if we look here, you can see in flexion, they should all move forward. This one didn't move, ma'am. This one didn't move. It's stuck. This is what we got to free up. Once we free this up, then we got to go to the upper. There needs to be more space gap. So we have pressure in the upper cervical. We have pressure C6, C7. We have L5, and then we have a tailbone issue. And I'm going to mention something similar as I've mentioned with other cases, similar to yours. I would want to stick in one system. And what does that mean? There's two parts. There's the sympathetics and the parasympathetic nervous system. Things that speed up, things that slow down. And I'll go in more detail on the when I'm done with the x-ray to explain why, okay? All right, so we have S3, S4, L5. We have C6, we have upper cervical, and then whatever else we're going to find here. This is the area that controls the digestion. It's in the middle of this kink here. That's it. All right. Any questions there? I know it's a lot of information. The main take-home message is the foundation is off and we need to sort out that foundation and your L5. That, and then we have some stuff going on up in the penthouse and the top floors of your building. Okay?
Yes. Is this something that you've been able to solve many times? But this problem, this is not unusual for you.
This kink or your symptoms?
My symptoms and the kink.
Well, that's come a long way. I mean, if you would have saw me 30 years ago, it'd be a different story. The idea right now is we have to stabilize her foundation, whatever that means. Number 2, we need to stabilize the neck. We need to get the power on. That's what I mean. Have I seen people with similar issues? Yes. Have they gotten their result? Yes. Have I had patients that didn't get a result? Yes. I have more that have results though.
Oh, good.
Okay. When it comes to this kink, my goal isn't to straighten out the spine at all. We're past that.
It's impossible, isn't it?
No. There is a possibility to get a little bit of height. There is. So starting today, in the house, in the bathroom somewhere,
Pull me up.
start marking her height. And as you start to see her grow, do it, take a picture, send it to me, bring it to me. Sit up straight, ma'am. And I guess the first thing we should actually do is watch you walk. And before you do that, let me just tuck you in back here. And I need to move your walker, sir, if you don't mind. I'm just going to move it over here. And what you get to do now is stand up and walk to the corner of the room and back a couple of times. And we're doing this without a walker if possible. This.
I'm having problems with my knees.
You just do the best you can. You can turn around now, ma'am.
I feel like I throw my legs because my knees have been painful. And so,
Take your time. If you need help, just ask
no,
us.
I'm okay. I never walked like this before. This is new.
Both feet out, upper cervical. Have a seat, please. Let's get started. Showtime. Showtime. Starting at the base of the neck. Starting at the base, first thing we're getting, 10 points, C6, left side. 10 points, C1, left side. T7, 8, left side.
Do I need to sit up better?
You sit whatever's comfortable now, okay? If you want to sit up better, you sit up better. Your choice. I want you,
Whatever helps.
whatever's comfortable.
Okay.
And there it is. S4. S4, that's more T8, T9, C6, C1. Now, let's go ahead and check her static palpation, check her spine. As we get to right about there, you can see the edema pulls in right there. 1, 2, 3, 4, 5, 6, 7, 8. More 10, 8. 8. T8. Let's check the low back.
Was that inflamed where I showed that it was painful?
Sorry, ma'am?
Is there inflammation?
That's where the pressure is, yes,
Okay.
exactly. Exactly. Now let's check low back, come back slowly towards me. That's 5. Tender.
Mm-hmm.
That's 1.
Yeah.
More tender.
Yes.
That's 2.
Yeah.
That's 3.
Oh.
That's 4.
Ow.
That's what I'm getting. Over. Let's try it again. Sorry. 5. That's 1.
Ugh.
That's 2. That's 3. That's 4.
Ow.
And that's 5. Number 4. Yes?
Yeah.
Okay. Sorry. All right. S4, T8. My job is to push the right buttons to get the power on.
True.
That's it. Right there, number 6, number 7, number 6, number 7. Both of them.
Yes.
Number 1,
Ow.
number 2.
Yeah.
I'm barely touching her, sir, dude. Okay.
Wow. That really hurts too.
I know. Okay, let's go slowly, man. Come back. I got you the whole way.
Thank you.
Don't worry, please.
Mm.
That's the one. 6.
By the way, I must say that there was a time that I used to crack my neck back and
Oh,
forth.
you a self-cracker?
Yeah, it was a long time ago, but I haven't done it recently. But I remember I did that a lot.
25 years.
Please don't try.
Is that a good thing to
Not
do?
for you right now, please.
Interesting. I will not.
Now let's check out top. Right? No. Game plan. Game plan. What are we gonna do? We're gonna do the sacrum. We're gonna do T8. T8 is a PR. PRT. S4. And C6 is also going to be a PR lamina. Okay, I can justify it. You ready for me?
How temporary is this kind of vexing? Do I have to keep coming back to you because
Very
the
good question.
Because I've been going through chiropractors before, so I,
Very good question.
good.
So when we're looking at what we're doing here and what's the reason we have chiropractors, keep it real simple, man. Okay. My job, find nerve pressure, find the vertebrae responsible that's misaligned, causing pressure on the disc and on the nerve. Now, when it's supposed to be like this, it's like this though. That's you. Has been like that for a minute. So we have a lot of osteophytes going on here, around here. There's less mobility here.
Oh, okay.
As I make the adjustment, it wants to go back sooner. I set them a little bit deeper, okay? And we have to change the habit. And the idea in your case, I'll give you an example. Someone's sitting at a desk all day. They come get an adjustment, they go right back to their desk. They go back to the same habits. And I give the analogy of the alignment of a car. You go get your car aligned. And then you start hitting the same potholes driving to work every day.
Sure.
Nothing holds.
Nothing.
In your scenario, as with all new patients, I'll see you 3-4 visits. That's it first. That's going to see and determine how you respond to the adjustment, number one, and the patient wants to be here. Then, as I see how you respond, I'll give you better information. Then you decide, you want to stay, and do the work, great. You don't want, whatever you want to do.
I can
But we have to
imagine not
figure
doing
it out right now.
Okay.
Okay? Does that make sense, sir? We got to figure it out. And
Can you always fix something, or is there some people that are in a position that, sorry,
who
can't do
sent you
anything
here?
for you?
Who sent you here? Dr. Bernie Siegel, famous cancer doctor, said there are no incurable conditions or diseases.
Wow, that's nice.
Only incurable people.
Oh, dude.
So do I have
MS?
incurable people? Yes, I have people that don't want to be cured. Do I have people that want to be in their story of their pain? Yes, I have that all the time. Now, I'm not curing MS, ma'am. I know. You know that. What I'm doing, I'm helping you maintain your structure. That's real.
Right.
Okay?
Keeping the pain in check.
Keeping the structure functional.
Ah.
Okay.
Okay.
May I start? May I go?
Yes.
Yeah? Okay. We're going to start on C6 as a PR lamina. We're going to come back towards me here. It's going to be very, very light. Back towards me. And she has that PR lamina. So if it's right, we're just going to turn the head there. And that's the home run. Got you. You survived. Check
I
it out.
trusted you.
Check
That's
it out.
why.
Check it out. Look to the left. Slowly. Look. Look to the right. Look left. Now from what I just did there, stand up for me, please. Take your time. Walk just a little bit. Just walk a little bit. Cool. Come over here now. Turn around slowly. And we're going to go face down over here.
I feel my legs feel more at ease to walk. You knew that you're doing that for that reason. Well, it worked.
What worked? You mean your legs feel lighter?
They felt like I wasn't going off the side.
You're right. Step on the black platform then. And you're going to go face down. Face is going to go there. Just lie your tummy here and take your time. Just lay forward. It's going to go down. Go. You did good, sir. You did good. Slide up a little bit, please. You did good. You're doing good. Let's do T8. Slide up a little more. There you go. PRT. What's a PRT? It's like ART. T8. PRT. Gotcha. That was a new move. Alright. Alrighty. Hi, Shasha. Hey, Shasha. So what's interesting with her is she goes into a spastic reflex. This is going to be, so I got to go quick. If I apply pressure, look, that's involuntary, correct?
Mm-hmm.
That's not you doing it. Good. You got her, Shasha?
Ow!
Gotcha. That's it.
Did it adjust?
Yes, ma'am. Thanks, Shasha. Good. Check it out. Wait for it. Let your feet stay planted. Give it
Okay.
a second. No rush, ma'am.
Okay, do I
No.
stand up then?
Yes, ma'am. I'm just tying you up in the back here. Hold my hand, please. Both hands.
Thank you.
I got you. Look at me. Raise your knees.
Hmm. I'm not as afraid. No.
Hold my hand. Let's walk.
I don't really need you.
What's that? I need you, though.
Oh, okay.
Turn. Check it out.
That really is amazing.
Check it out. You guys are going to go dance soon. Turn. Turn. You better take your dancing soon. Even if
No, I
it's in the
don't think I
living
want
room.
to dance.
Stay in the living room. It's fine. Check it out.
Man, I must really have been crooked. I could not walk.
Well, you do remember I've been telling you that.
You want to be right or happy?
That's right.
I'm just giving him a hard time.
Well, he also does not want me to walk without walking with that.
For right now, I think that's a good idea, okay?
Okay.
Even if you feel good with what I'm doing, all right?
Okay,
Let's be safe. Let's not be
I agree.
over ambitious in this first week, okay?
Okay.
The number one thing right now is look how you're sitting. It should feel a whole lot easier, man. You're not
It does.
slouchy.
Yeah.
You don't feel as slouchy, I believe. Clear. C6. I wish I could say the battery's off, but there's no battery in this. Now, see, misleading. I have to follow the contour of the spine. If I miss the contour, it looks like a reading, and it wasn't. Follow the contour. There. Bam! I got the proof. Back towards me. Check it out. Check it out.
So you get to see,
Look. 5. Feel it. Check it out.
where's 5?
That's the one I was touching. You were like, ow, last time.
Ah, okay. that
Check
was
it out. 1. Watch. Check it out. Number 2. Come on back.
Okay.
Different.
It is. It doesn't hurt.
S3.
Earl, this
She is
hurt
not a
before.
paid. She is not a paid actor. Okay, guys.
I know, I'm not. But you're
Check
right,
it out.
it was hurting.
Look. Go, 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 go.
Wow.
That's what I'm saying. Can I do your shoulders now?
Please.
You got it. But before I do that, let's do some ear action.
Jeez.
That's going to help your balance.
It's
Yeah.
interesting.
What is?
I saw you do that to someone, one child or whatever, and I thought that was looking very different,
On your back,
the
man.
way you,
Lay down on your back.
It looks different the way I do that.
with the ear. You were pull the ear or something, just for someone, I said, that's different.
I pull toes too. Raise your right leg now.
Right,
Up.
right.
Left leg up. Sit up and turn. Go walk to the corner by yourself, please, and back. Looks pretty good. Looks a little different to me. sir.
Why?
What do you think?
Can you tell the difference?
Are you kidding?
Wow.
That's a difference between,
I'm a little bit afraid. though.
For what? Hold my hand. Walk faster. Come on.
Okay.
Turn around.
But I want to be able to walk on my own.
You'll do it. Well, that's your own fear, not mine.
total
Look.
difference.
Look.
Different person.
Yeah.
Where'd the first one go?
She's next door. Come back over here. Have a seat.
Oh,
I'm
Earl,
glad you guys can handle my humor. Okay?
I love that kind of
Well,
humor.
All right. I'm not for everybody. I get
Yeah,
it.
well, that's my MO.
Yes.
He's the jokester.
Oh, yeah.
Oh,
Good. Be childlike, not childish.
yeah.
Very different. Now you get a buff and polish, then you go home and do your wash and wax.
Okay.
4, 3, 2, and 1. 5, 4, 3, 2, and 1. All right.
I look pretty straight there for my shoulders.
Stand up now. Squeeze. Come over here, please. Face me. Squish. Good. Squeeze. That's strong. This is stronger. Give me the right hand. I don't want to mess with them. I like them. Very good. You have any questions for today?
How long is this supposed to last for me?
I have no idea. I'm going to see you in a couple of days anyway. Today's
Okay.
Monday. I'll see you Wednesday and Saturday.
Good. Then I'll
And
know
then-
better then.
Yeah, absolutely. And then we'll make some decisions the following week.
Perfect.
Fair enough?
Yes. Tell me, I've always have been to chiropractors, but to me it's always temporary. How do you keep the
Well, the
The,
last few you went to
repair.
didn't do much.
Why don't we address that next week?
Okay.
And I'm happy to answer it.
Oh, I'm so
Guys,
glad.
I'm happy to answer.
Thank you.
Okay? But let's have you experience the difference
Ah.
first.
That would be great, because I
And
feel
you will
the difference.
Yes, and you will probably
Thank
have the
you.
answer to your own question.
Okay. So how long is this supposed to last? I could go for a week and I should feel the same?
I will be seeing you on Wednesday and Saturday this week, okay?
So it doesn't have to go a
In the
week?
be- In the beginning, I'll see you those few visits. After that week, we'll decide what we're gonna do. Fair enough?
Fair enough.
Okay?
Yes.
Welcome to the office.
Thank you so much.
You got it, my dear sir.
Yes.
Pleasure.
And I thank him because his wife has been crooked for a long time and he felt.
His
After
wife?
seeing this program.
Who are you?
After seeing the
You're
program.
You're talking
on
like
the
a third
internet-
person, yo. What's up?
Seeing the internet, which was a good thing that you have, the one that you recorded now, but that was the only thing that helped us know this possibility of help. And then to find out you were in Los Angeles. I mean, we came from the desert, but definitely fantastic coming out to see you.
Pleasure, man.
Thank you very much.
God bless you.
I look forward to seeing you again soon.